Hi, everybody. Thank you for joining the webinar today. It's called Sustainable School and District Policies and Practices, and it's with the We Choose Health group here in Illinois. I apologize for the registration issues and not everyone having the link, and appreciate you and your patience while we got that figured out. And we are recording the webinar today, so for those of you that joined a little later, have questions, or we're having access issues with the link, again, we apologize and we will send it your way. We are using a technology today called GoToWebinar, and I want to go over a couple of logistics before we get started. So on the right side of your screen, you will see a control panel that has the logistics listed. If you have a question, you'll see there is a question box there. Go ahead and enter any questions that you have into the question box, and we will answer them throughout the presentation today. And if you have any additional questions that are technology issues, please go ahead and enter them into that question box there as well, and we will go ahead and monitor that. So now I'm going to turn it over to Amber, who's going to kick us off.
Great. Thank you, Hannah. Hi, everyone. Thank you for joining us on our webinar today. This webinar is part of the We Choose Health evaluation. Our webinar is Sustainable School and District Policies and Practices. Of course, this webinar is supported by funding from the Centers for Disease Control and Prevention. Next slide, please. My name is Amber Uscali, and I'm just going to do a quick overview of our webinar today. I am the project director for the We Choose Health evaluation. So I'm going to start off with some We Choose Health, just really quick background. Then I'm going to turn it over to Dr. Jamie Shrieky, who is going to discuss We Choose Health district wellness policies. And then next to Hannah and Brian from Action for Healthy Kids, who will discuss healthy schools. What do we do next? Next slide, please. So most of you are We Choose Health grantees, so this information is not new for you. But We Choose Health is a community transformation grant, and we are a rest of state grantee, so our grant excludes the 5 largest counties. We have 19 sub-awardees who are local health departments who operate out of coalitions, and these coalitions span 58 counties throughout Illinois. Now we have 15 sub-awardees who cover 48 counties who are implementing aspects of coordinated school health. The coordinated school health model includes a whole variety of different health and wellness components, and we are not including all of those in the We Choose Health effort. So We Choose Health grantees focus specifically on healthy eating, physical activity, and social emotional wellness. Those are all priorities of the CDC. So for coordinated school health, We Choose Health grantees focus primarily on sustainable and policy changes. And these are just some examples that I've listed here. So a lot of grantees did obesity prevention curriculum through PE. Some also did curricula through nutrition. So Catch PE is one thing that was very popular with our grantees. There were also school-level policies that were adopted and promoted, things like healthy vending policy, so you only have healthy fruits or foods in your vending machines, or healthy fundraising, so you can't sell junk food in your fundraising campaign. So those are sustainable policies as well that don't take funding to continue. So those are really objectives of both the CTG and We Choose Health. And then we also have district wellness policies, which is what we're going to focus on in our webinar today. Next slide, please. So wellness policies were collected for the CTG We Choose Health evaluation. So to determine what districts we were going to collect wellness policies for, I sent out an email to our We Choose Health grantees in the summer and fall of 2012 just asking them what districts in their area did they plan on targeting. Who did they hope to work for with their We Choose Health Coordinated School Health initiative? From that, we received 70 districts that were identified, and our sample includes 66 districts. Jamie will talk about, Dr. Jamie Shrieky will talk about how she got those districts and how she sort of got those wellness policies. But we will be sending out a district wellness policy analysis for each district that was included in that sample. I'll be sending out a list of the schools that were included in that sample in the next week or so, and our goal is to have the district wellness policy analysis ready for you by the end of the We Choose Health grant period, so around September 30th or so. I do want to note before we continue on with the presentation that not all districts identified as those target districts actually ended up participating in We Choose Health because they were just targets. And then not all We Choose Health districts were included. So some districts hopped on board with We Choose Health after I solicited that survey. So if, as a grantee, you'll be receiving these district wellness policy analyses too. If you receive districts that you didn't end up working with, that's just sort of the background on why. Okay, with that, I'm going to turn it over to Jamie Shrieky.
Okay, can you hear me okay, Amber? Or Hannah?
I can.
Okay, great. And can
yes,
you see my screen?
Your screen. Yep.
Wonderful. Okay, well, thanks everyone for joining us today, and it's a pleasure to be on with you today. As Amber mentioned, I worked with Amber and Hannah and Ryan to examine the wellness policies for 66 out of the 70 districts. In a second, I'll explain why we only had 66. So today I'm going to give you a little bit of background for those of you who maybe are less familiar with the wellness policy requirement at the federal level. I'll just quickly run through that. I'll talk a little bit about the methods that we used for collecting and assessing the We Choose Health District's wellness policies, present you with some summary data across all the district's policies that we examined, and then also introduce you to that fact sheet that Amber mentioned. I'm going to show you how to navigate the fact sheet when you get it for the districts in your, for your grantee site. So real briefly, there are two key federal laws that are most applicable for wellness policies. The first one was enacted by Congress in 2004. It was the Child Nutrition and WIC Reauthorization Act, and it required that by the first day of school year 2006 to 7, that all school districts nationwide participating in the federal child nutrition programs, that would include the National School Lunch Program, School Breakfast Program, After School Snacks, Milk Program, Summer Food Service Program, that they adopt and implement a wellness policy by the first day of the 2006 to 7 school year. The federal requirements were very broad. They're actually listed here under required components. It was simply goals for nutrition, education, physical activity, and other school-based activities, guidelines for all foods sold or served on campus outside of the meal programs. That's commonly known as competitive foods and beverages. An assurance that reimbursable school meal guidelines were at least meeting federal school meal guidelines, implementation plans, and involvement of some key stakeholders in the development of the policies. In 2010, Congress reauthorized the Child Nutrition Act, and in there, and that was part of the Healthy Hunger-Free Kids Act of 2010. You're probably familiar with that. In there, they reauthorized the wellness policy component as well, and I've highlighted for you in bold here 3 bullets in particular that are additional items that were not specifically called out in the 2004 law. So specifically, they're calling for permission for a variety of different stakeholders to participate in policy development, implementation, and review and updating, coming up with a plan to inform and update the community about the policy content and implementation, and then requiring periodic reporting and measuring wellness policy implementation. Today I won't be focusing so much on those components as much as the elements of existing policies that relate to the original categories. For those of you who are familiar, the USDA, the U.S. Department of Agriculture, also as part of the Healthy Hunger-Free Kids Act of 2010, included language in there for the USDA to promulgate a regulation or a rule that will provide guidance to districts on their wellness policy content and to require standardized reporting. USDA issued a proposed rule earlier this year, and public comments were due in the spring of 2014. They're currently reviewing all those comments, and a final rule is expected to be issued sometime during this current school year, so sometime in the 2014 to 15 school year. But it's the federal government, and anything is possible, so we'll just wait and see. So let me tell you a little bit about what we did here. Some of you may be familiar with my work and my team's work. We conduct the largest ongoing nationwide evaluation of congressionally mandated school district wellness policies as part of the Bridging the Gap Research Project, which has been an ongoing evaluation funded by the Robert Wood Johnson Foundation since the beginning of 2006 to 7 school year. Some of you may have participated in the Action for Healthy Kids webinars I've done over the years highlighting the data from that study. Methods here are very similar to that. that. What we did here was we collected hard copies or electronic copies were available of on-the-books school board approved wellness policies, as well as all associated superintendent's regulations, guidelines, or procedures. Most districts will have a board policy as well as superintendent's regulations or rules for wellness policy as well. And then we also included any cross-referenced board policies or superintendent rules or regulations, as well as embedded state law and model policies where they existed. We actually obtained the policies from 66 out of the 70 districts, as Amber mentioned, and we collected the policies via internet research with telephone and electronic mail follow-up and verification with all 66 districts to verify complete capture of the policies that we were collecting. The remaining 3 districts, we were not successful in getting their policies, so that's why we only got them from 66 out of the 70 on the list Amber originally gave us. And that's pretty typical. Usually we have a policy collection rate of about 94% across our nationwide data, so this is pretty consistent with that. We analyzed the policies across 9 different categories of items. The items that are asterisked are those items that you might recall from my slide about the Child Nutrition and WIC Reauthorization Act were specifically called out in that original requirement, as well as in the follow-on Healthy Hunger-Free Kids requirement. So nutrition education, school meals, competitive foods, physical activity, and implementation evaluation reporting have always been part of the wellness policy provisions. We also added in some elements to our analysis related to physical education, staff wellness, and modeling, communications, and marketing and promotion. These have just been part of our nationwide study for years, so we included them for this analysis as well. So across each of the 66 districts, we evaluated their policies across a number of different provisions within each of the 9 categories. So within nutrition education, we looked at 7 specific items, school meals 16, competitive food and beverages, it was like 120 items, physical activity 10, so on and so forth. We analyzed all the policies by grade level of applicability, so we analyzed policies that are applicable at the elementary level, at the middle school level, and at the high school level, particularly since our national data showed that we tend to see much stronger provisions applicable at the lower grade levels than at the secondary school levels. We used a coding scheme that was originally developed by Marlene Schwartz and colleagues at the Red Center as part of a Healthy Eating Research grant. That tool is now called WellSat. The WellSat tool, for those of you who are familiar, only includes about 50 items. Our tool, as you saw on the prior slide, includes a lot more items, and it goes into a lot more detail on a lot of categories, as well as doing grade level coding. But the commonality across the tools is we evaluate all the policy provisions for 3 things, either not existing, so a 0, a weaker suggested provision, or something that might apply to some grades within the grade level, or for competitive foods, some but not all locations, like vending machines but not school stores or fundraisers. And then a 2 is a strong or required provision at all times. So here's an example of that. This is an example for nutrition education curriculum for all grades, which is one of the 7 nutrition education items we looked at. So a 0 would be no provision. The district wellness policy is completely silent on nutrition education. A 1, a weaker suggested provision, first example would be they encourage nutrition education as part of the wellness policy, but that's all they do. A second example might be they only require nutrition education at the elementary level for 3rd and 5th grades, but are silent on nutrition education for 1st, 2nd, and 4th grades. And then finally, a strong policy would be one that requires nutrition education for all grades, and specifies a minimal amount of time that's consistent with the state health standards for nutrition education. For each district, we also, in addition to evaluating all those items that I showed you in the prior table, we also created a comprehensiveness and strength score across the 9 categories that I mentioned earlier, as well as across all 184 or so items that we looked at. The comprehensiveness score basically represents the proportion of all the items either within the category or across categories that were addressed. And then the strength score is the proportion of items that were definitively required. So on the next slide, I show you an example here. So across the nutrition education category, you can see here in the elementary policy of applicability They address 5 out of the 7 provisions we looked at, which will be a comprehensiveness score of 71 out of 100 points. But only 3 out of the 7 are actually required. They got a score of a 2. So their strength score was 43 out of 100. And in this example, you can see they had a similar comprehensiveness for middle school, but only 2 of the items were required. And then for high school, they had slightly less comprehensiveness and only 1 item was required. And this depiction is very typical of what we typically see with our data. So now let me get to the results, because this is what people really care about. So the good news is that we choose health districts that we analyzed. Your policies look very similar to our national data. The reality of the situation is, all 66 of the districts we looked at had a wellness policy, so that's fantastic. And virtually all the policies address the required elements from the wellness policy. So they have goals for nutrition education or goals for physical activity. They include some language about school meals and competitive foods, and most of them have implementation and evaluation provisions. As I mentioned earlier, we also added in physical education here because of the import that it has for daily physical activity in schools. So the good news is districts are addressing the required elements. Where things vary greatly, though, is in the extent to which they're addressing them, and that's very consistent with what we see in our national data. As you can see on this slide, I looked at the comprehensiveness and strength of the We Choose Health Districts policies. So you'll recall those are on a scale of 0 to 100, and within each category, each of the 9 categories, as well as across the board. And as you can see here, very consistent with my national data, district policies tend to address a lot of things, but they tend to be fairly weak when they do address them, meaning they encourage them, they may apply to some but not all grades, they may have limitations on locations of sale for competitive foods, but for the most part, the wellness policies are advisory or provide guidelines or suggestions, but they don't require as many things as they address. And that's very consistent with what I see with the national data. So the We Choose Health Districts look very similar to our national data. Here, we compared the We Choose Health Districts policies against the codified state law for Illinois, both their statutes as well as the administrative regulations. Again, looking across the whole host of elements that we looked at, the 9 categories. And as you can see here, this is the comprehensiveness slide. So this is what proportion of the items are actually addressed. And as you can see here, for the most part, with the exception of school meals, for the most part, the We Choose Health Districts policies look much better than the state law does. So that's great. And that's usually what that means is that the districts are implementing, they have stronger policies, they'll be more likely to implement them at the local level than if districts were just relying on state law. And then when we look at strength, we see a similar pattern, although the state law for PE is stronger than the district policies, and that's also typical because PE tends to be more of a state level policy than district in most states across the country. But there are some topics that districts are addressing that are not really addressed at all in state law. So that's just the summary data across the districts. And now let me show you quickly how to navigate your own fact sheet if you're one of the grantees that will have districts that we've evaluated. And so as I mentioned earlier, for each district, we created a district-specific fact sheet summarizing your findings. We compared the district policy against aggregate data for all 66 districts that we looked at, as well as our national data for bridging the gap. So you'll be able to benchmark and see where your district stands relative to the other We Choose Health 66 districts in the national data. And then we also provide item-by-item scoring for each district's policy. So this is just samples from a couple of pages from the fact sheet that I'll walk you through. I'll walk you through each one. So the first page is a background page. It basically introduces you to what we did here. We explain how we define wellness policies and what the different scores in your fact sheet mean. The next page starts our benchmarking, and so the second page covers nutrition education, physical activity, and physical education. The yellow bars are your given school district's data. The green bars are the We Choose Health target school districts, the 66. And the blue bars are our nationally representative data. So in this one example slide you can see here, and this is nutrition education, this is comprehensiveness, and this is strength on the right side. You can see here that this particular district example their nutrition education provisions were slightly less comprehensive than all We Choose Health districts, and were about the same as the national data. And across all three categories on strength, they were all pretty comparable to one another. Whereas over here, when we look at physical activity, this district's policy is less comprehensive and less strong than either the We Choose Health districts or the national data on physical activity provisions. Competitive foods got their own page, mainly because we code the most items relative to competitive foods and beverages. We also find that the policies vary most greatly by grade level of applicability on competitive foods, so we break that out for you, elementary, middle, and high school, or over here, elementary, middle, and high. And then we also present the comprehensiveness and strength scores. And this is a perfect example where overall it doesn't matter what level you're looking at. Your district, We Choose Health, or national data, the high school level policies tend to be much weaker than the elementary and middle school policies. The last page gives you overall summary score information to see how you stand relative to everyone else across the items. And then there are two sections in here that Hannah will be talking more about related to policy opportunities and resources that will be tailored to your specific district. Action for Healthy Kids helped to develop those sections, so she'll talk more about that. And then we have a page that just gives you a brief overview of our methodology and a couple references. And then finally, the back page is an item-by-item selection showing you how the district scored on various components, strong provisions, weak provisions, or none. We pulled out a sample of the provisions that were of most interest to the department, and We Choose Health. We're also preparing an overall summary report that will have data on all the variables we looked at across all the districts. They won't be district by district, they'll be aggregate data. And then in competitive foods, we also broke everything out by grade level as well. This is my contact information. I'd be happy to take any questions at the question period or follow up with me afterwards. Thanks very much. Hannah, are you taking control back? Yep.
I am. Thank you so much, Jamie. That was great. Let me get back to my presentation. Okay, so as Jamie just outlined, she was able to put together these wonderful fact sheets for all of you to compare where your districts fell in comparison to other We Choose Health districts, as well as her national survey sample. And what Action for Healthy Kids helped to do was really figure out what we can do next. So I'm going to talk a little bit about Action for Healthy Kids, and then I'm going to be joined by our Illinois State Coordinator, Ryan Monroe, and we're going to talk a little bit more specifically about some of the opportunities and resources we suggested as Jamie outlined. So who is Action for Healthy Kids? For those of you who don't know, Action for Healthy Kids is a national nonprofit that fights childhood obesity, undernourishment, and physical inactivity by helping schools become healthier places so kids can live healthier lives. And that's a big fancy way of saying just what you see here on the screen, is we believe that good food plus active bodies equals kids are equipped for success. And we know that the research shows that physical activity supports academic achievement. We know that kids who eat well learn better. And we know that schools that have healthier practices can actually increase the school's bottom line from a budget standpoint. So like Jamie was outlining, and like you see here on this slide, we know healthy kids learn better. And our mission at Action for Healthy Kids is that every kid be healthy. We believe, again, that every kid needs to be healthy because kids who don't eat nutritiously and enjoy regular physical activity may actually be at an academic disadvantage. So what we really are hoping to help you with through these fact sheets and moving forward in the future as your We Choose Health funding comes to an end, is we're hoping that Action for Healthy Kids can be a resource for you to keep your work alive and going. And now I'm going to turn it over to Ryan, who's going to tell you a little bit more about specifically with these fact sheets what Action for Healthy Kids did, and then we're going to walk through some next step suggestions for you. Ryan, are you muted? Ryan? Okay, well, Ryan must be having some technical difficulties, so I'll go ahead and start for him, and if he jumps back on the call, we will turn it back over to him. So like I said, we made some policy recommendations to you. So on page, one of the pages of the We Choose Health fact sheets, you're going to see an area that looks like this, what you see over here on the right side of this slide. So these suggestions were provided based on the data that Jamie has compiled. So from looking at your wellness policy, from looking at the last page of the fact sheets that have kind of scores on how you scored on her assessment, and then also kind of looking at your wellness policy language. So we tried to provide you with some opportunities in areas where your original school policy or practice could be strengthened. So we did not only that, but we also hooked you up with resources or tools that could help you implement the suggested policy opportunities. So you'll see in the box, the second box highlighted there on the bottom of the right side of your screen, that each one of the opportunities has a matched resource, and they are resources from kind of all of the leading partners in our field: Action for Healthy Kids, Center for Disease Control and Prevention, the USDA, Shape America, which is formerly AFHK, and is now Shape America. So we really wanted you to not only be able to see the recommendation that we were given, but also be able to utilize the resource that shared how to make the changes that you need to make. I'm going to pause just a minute. Ryan, are you back?
I think so. Am I here?
There you are, yes.
All right, perfect. All right, so I'll take you through the common opportunities and resource areas that we saw with several of the schools to help implement and develop going forward with your wellness policies. One was one more school health index, the school health team developing of school wellness policies, physical activity and education guidelines, competitive food and beverage standards, and then Healthier U.S. Schools Challenge certification, which we will talk more in depth here to come. So one of the first major opportunities is to complete the School Health Index. This is to identify policy and program opportunities that will help serve as a guideline for you going forward with what to focus on with your school health policy.
Definitely. So I know as a We Choose Health county or a school district, you're very familiar with the School Health Index because you've completed it. It is recommended that you complete the School Health Index annually as your policies change or your practices change, either annually or when you have kind of a major change to those policies and practices so that you can track your progress. So now that you have a great baseline from the We Choose Health assessment, it's a great next step to, as you're making changes, to kind of update that. You don't have to go completely from the start again. You can kind of look at your current school health index and really update the areas that you feel need to be changed based on the work that you're doing, and really use it as a way to kind of track your progress moving forward. You might have recently heard that the Alliance for a Healthier Generation, one of our national partner organizations, recently started to integrate the School Health Index into their Healthy Schools report card program, and Action for Healthy Kids is working on the same thing, integrating School Health Index language. So as a national coalition, we're trying to be really cognizant of all of the different options that are out there and make all of our options more similar so that you can use it across the board, and also have recommendations based on the scores that you get in your School Health Index, get automatic recommendations and pointing to resources. So your fact sheets that you're getting from us today are a great first step in that process where we've looked at your policies and given you individualized recommendations for resources and next steps. And moving forward in the future, there will be more resources like that. So do stay up to date on the School Health Index and kind of what is happening there in priority areas for your district.
Another major opportunity that we saw with different wellness policies was to appoint a wellness champion or school health team at each school to help coordinate policy development and implementation activities for accountability. This counts as having someone at each location to help kind of lead and guide the wellness policy and make sure it's on the right track and everything is adhering to the process. The other one is to ensure that the district wellness committee review and update the wellness policy at least every 3 years. This is to make sure that everything is up to date and meets the standards of different policies, national policies and things like that as they go forward.
Definitely. So we've talked about this in a previous webinar with your teams before. So the federal regulations around wellness policies suggest that you have a district-level wellness committee, which is fantastic. And as Ryan said, we do recommend that that policy be updated every 3 years. We're waiting on the USDA right now to give more guidance on some of the things that are outlined in that kind of initial local school wellness policy requirement that's in the Healthy Hunger-Free Kids Act. And as Jamie said, we're hoping for some further guidance on that later this year. So there probably will be more details there about district-level wellness teams, but really at Action for Healthy Kids, what we encourage you to do is not only have that district-level wellness team, but also have school-level health teams. So having those either a champion or a team of people, and we do recommend at least a 5-person wellness team in each building to help coordinate policy implementation at the building level and programming to make sure that you're in alignment with policy is really critical for accountability back to that wellness policy. So there's some great resources listed here. I know you're all very familiar with district wellness teams, but any support that we could give you around building school-level teams and having them act as kind of an accountability system for district programming and policy requirements, we would be more than happy to do that. So do check out those resources and get in contact with us if you have any questions.
Another major opportunity that we saw was regarding school wellness policies was to ensure that the policies are consistent across all grade levels. As they talked about with the competitive food and beverage especially, making sure that the guidelines match no matter what grade level they're at and make sure that it's a standard that they hold to for all grade levels.
Definitely. So I know that we've shared this with you before, but I'm going to navigate away from the PowerPoint for just a minute and show you again the Action for Healthy Kids Wellness Policy tool. I know we did a webinar about it earlier this year about the tool itself, but it has great steps, 7 great steps on how to really work on revising your wellness policy. So I know as we were reviewing wellness policies and as Jamie was reviewing them, we all saw that a lot of your districts have not updated your policy for the Healthy Hunger-Free Kids Act, and it's still that original policy, you know, based off of old 2004 regulations. So the first step for a lot of you is updating your policy to meet the new regulation requirements. So our 7-step tool here is a really easy way to make sure that you have policy that's supporting healthy kids. So step 1 is build a strong team. Step 2 is assess the environment. Step 3 is draft the policy. 4 is adopt the policy. 5 is implement the policy. 6 is measure and evaluate. And 7 is communicate the results. So as you're walking through this tool, you can click on each step and it will navigate you to some good tips around each one of those steps. There's also within this tool resources related to all 7 of those steps. So it's a really great resource for you as you're updating that policy, not only to meet federal regulations, but also to meet the environment and the culture that you have of wellness in your school. Ryan, are you back?
Yep. The next wellness opportunity that we saw regarded physical activity or physical education, and this was to help promote physical fitness and to get students to move more often, be more active throughout the day. We wanted to develop comprehensive school physical activity plans and integrate related language into the wellness policy. Another opportunity was to include daily recess requirements and minute specification into the wellness policy, and then also to incorporate language to align with the Illinois daily PE requirements into the wellness policy and aim to not allow waivers out of the daily PE requirements within the next 3 years to help guide and promote a school of more physical activity and physically active students.
Definitely. So the first recommendation there is around comprehensive school physical activity plans, and the link out to the resources really of this CDC Comprehensive School Physical Activity Plans like guide, and it's a really fantastic resource to better understand kind of what comprehensive physical activity means and how you can integrate it or move towards integrating it. But really it means that you would be providing 60 minutes of physical activity each day in your building through a wide variety of places across the school day. So through physical education, through physical activity before, during, and after school, having a staff wellness program that incorporates physical activity, engaging family and community, incorporating active recess components. So it's really a great resource here, and you can see here kind of the outline or the diagram of what a comprehensive school physical activity program means. Action for Healthy Kids is also co-hosting a webinar with Let's Move Active Schools in October, where we're going to talk more about comprehensive physical activity plans and programs for your school. So it's a really great one to join as well. The including a daily recess requirement and minute specification in your wellness policy is really important as well. A lot of school districts across the Midwest just have kind of a culture where recess has always been a part of the day. The minutes have been fairly stable, but what we really encourage schools to do is really just make that part of your policy and make sure that that language is permanent in your district. To recognize and acknowledge that you think kind of free active play during the day is important back to learning. So even if it's a part of your culture, we really recommend that you do add that language to your policy just to kind of publicly demonstrate the importance that you see towards your learning environment. And the same is true with daily physical education. So we all know that Illinois has some of the strongest regulations requiring daily physical education of any state across the country, but we also know that the majority of Illinois schools don't actually have daily physical education because they use the waiver system to get around that policy due to staffing and space needs and minutes of the school day that are needed to go towards academic requirements. But we've seen a great impressive move here by the Chicago Public Schools to make this daily PE requirement a reality as they did not renew their waiver for this current school year, and moving forward they're going to be incorporating daily physical education K-12. So we really encourage you to learn more about what Chicago did and think about in your own community how over the next couple of years you can move to increase your physical education minutes to a place where you can get them to meet that state requirement. And again, Action for Healthy Kids is happy to be a resource for you as you're doing those things or as you have questions around them and support you in the work that you're doing.
The next opportunity that we saw in regards to competitive food and beverages. We want to make sure to incorporate the required USDA competitive food and beverage standards into the wellness policy. And just a brief overview, competitive food and beverages are the foods that are sold or available in schools outside of the federally reimbursed school meals.
Yeah, so Jamie talked about this a little bit as well. We connected you to this great kind of summary document on the new rules. So any food that's sold outside of the lunchroom, there are new requirements for. This document actually includes lunchroom requirements too, and then near the bottom it does talk more about competitive foods and the requirements of the new federal regulations. So your food service department at your local schools is definitely very aware of this new policy change as they had to work on this over the summer and get it into place for your district. But we just want to make sure that the language in your policy matches the requirements of these nutrition standards as well. So as you're talking about updating those policies this year, make sure that you're making the changes required to your wellness policy by incorporating that language in as well. just so, again, you have a very comprehensive public dedication to your wellness program moving forward.
All right, and then the final common recommendation that we suggested was to apply for the Healthier U.S. Schools Challenge certification. This will help you obtain recognition for your school's hard work for the wellness policy, but also to be, just like I said, be rewarded for the efforts related to school wellness.
Yeah, so Action for Healthy Kids believes that every school in the country has the opportunity and should push towards being Healthy School certified, which means that you're a school that's been nationally recognized as a healthy school environment, and that you really have the policies and practices necessary to make sure that every student in your school is healthy and ready to learn. So we recommend that schools apply for the Healthier U.S. Schools Challenge. It's hosted by the USDA and the Team Nutrition Program, and it is a national certification around your smart lunchrooms and your physical activity programming. And it incorporates also your policies, and you can apply for bronze, silver, gold, or gold with distinction level awards. And there is a monetary award that comes back to you when you're recognized, and lots of resources out there, as you can see on the USDA website, to help you apply. There's a new application coming out this month that does incorporate some of that competitive foods language and the changes around that. So the application is going to be different than it was last year, but we're happy to announce at Action for Healthy Kids that we're working specifically on taking some of the resources from the USDA and the Team Nutrition website. As you can see here, there's lots of application resources, and they can be a little bit hard to sort through as you're pulling together this application and make it a little bit overwhelming. We are working to, with the USDA, to kind of simplify those resources so that it's as easy as possible for you to apply for this award. So we want to help you do this. So if you're interested in your policies and your programs you think are strong, or you want to work with Action for Healthy Kids to increase the strength of your programs, please do connect with us, because we are here for you, and we can help you walk through these steps this school year and support you. And that's a big resource to get a national certification on your school's health and wellness environment, and can be a really great next step as the We Choose Health funding is kind of wrapping up here. So like I said, we definitely are here to support you. Ryan is our Illinois State Coordinator, and he's your kind of main contact for any questions that you might have related to Action for Healthy Kids resources, or any of the opportunities or resources that are listed on your fact sheets here, including especially the Healthier U.S. Schools Challenge certification, which is a great way to keep your momentum moving forward for all the hard work that you have done in the last 3 years through the We Choose Health grant. So we do encourage you to connect with Ryan, to connect with Jamie, if you have any questions about the fact sheets or next steps that you can take for We Choose Health. All right. Amber, I don't see any questions in the question box. If you do have a question, go ahead and navigate to your control panel and enter a question there. We will hang out. Amber, do you have any other points you'd like to clarify, or questions that came up for you while we're waiting?
Well, first I just want to thank both you from Action for Healthy Kids, Hannah and Ryan, and also Jamie, for presenting this webinar with information that I hope is going to be useful for you We Choose Health grantees, and also for your schools, but also for all the hard work that you put in creating these really tailored district wellness policy analyses and resources. So we hope that all of you on the webinar grantees, that you'll be really pleased with this product, and we want to encourage you to reach out if you have any questions, because it is meant as a resource for you. So I know that you have my contact information. We will be sending around the webinar, as well as a list of the schools that are included in the district wellness policy analysis, in advance of actually sending you those district fact sheets. I also wanted to add that the policies that were used for this coding are from 2012. So they are the baseline. So it's possible that some of you have updated your district wellness policy analyses since then. And if that is the case, then your policy analysis that you'll be receiving, it is going to reflect the baseline, so from the beginning of We Choose Health. So it won't be able to incorporate any changes that you've made.
Great. Well, I don't see any questions that have come through. So you have both Ryan and Jamie's contact information, and you also know how to get a hold of Amber. So again, thank you for joining us today, and apologize for the technical difficulties at the beginning. And we look forward to working with you in the future and having you join us for future webinars.
Thank you.
Have a great day, everybody. Thank you.